70 years old and retired from active employment in 2002. I live in Studlock, and although overweight, I have always been reasonably fit and active. I enjoyed walking, cycling, and was always busy in the garden. I can't remember when the pain first started in my hip, but I physically took notice of it the day I collected my sister-in-law from Aberdeen Airport. At first I thought it was just stiffness from driving a distance. I didn't think much about it. Although it persisted, it wasn't bad, so I put it to the back of my mind, expecting the pain to go away. The pain did subside gradually, but at the same time I felt a tightening at the top of my left leg, causing me to walk with a slight limp. I didn't take much notice of it until one morning while I was taking our dog her usual morning walk. To get to the woodland path, I had to cross a small distance of rough ground. Trying to keep pace with the dog, I caught my left foot in a small briar and tripped over, putting all my weight on my left leg. I immediately felt a jarring agony in my left hip. I had to stop walking and lean on a tree for support. It was 2 to 3 minutes before I could move and put any weight on my leg. The left hip was very painful, and I could only continue walking slowly and with a pronounced limp. The pain continued, so the following week I made an appointment with my doctor. At the same time, I was having great trouble sleeping at night. I could only lie in a position with no weight on my left side. This involved tossing and turning to find the position which caused least pain. Sitting down and bending also caused great pain in my left leg. The pain seemed to move between my knee and thigh, and I started to think that it was my knee that was causing the trouble. I had an exploratory knee operation years ago when the surgeon removed damaged cartilage from around my left knee joint. Maybe my old trouble had come back. However, my visit to the doctor confirmed that the pains were indeed coming from the hip region, and after examination he suspected the trouble was caused by arthritis. Back and forward movement of the leg wasn't too bad, but any lateral or side movement was agony. My doctor prescribed painkillers and referred me to Dr. Gray's hospital for an x-ray. Walking was still painful, and I had a pronounced limp affecting all of my more energetic pursuits I was used to. The painkillers helped, increasing mobility slightly. I attended the hospital and the x-rays were duly taken, referring me back to my doctor for the results a week later. The x-rays showed that though there was indeed arthritic wear in my hip joint, the medical opinion was that there was not enough damage to merit any kind of operation at this time. My doctor explained that the specialists are very reluctant to operate on anything other than severe immobility. The fact that I have type 2 diabetes has probably got something to do with it as well. All my doctor could suggest at this stage was give me a stronger painkiller, and he suggested a referral for physiotherapy might help. The physiotherapy lasted for 6 sessions and didn't really help. The painkillers helped in so much as they put me to sleep for half the day. The other things I struggle with, for example, my car. I found I had trouble getting in and out, especially the near side. In fact, I could only vacate my seat if there was enough room to open the door the full 90 degrees. To help with this, I applied for and eventually got a blue disabled badge. This helps a lot with parking and access. At least 6 months passed with no improvement, so much so that at my wife and family insistence, I made another appointment with my doctor to see if any more could be done. When I saw my doctor, he was very sympathetic and promised to refer me to the orthopedic specialist. I was called to the specialist at Dr. Gray's eventually. He too was sympathetic, but repeated the fact that he was reluctant to operate. He explained, however, that he could give me a cortisone injection in my hip under local anaesthetic, which should keep me pain-free for a maximum of 1 year, after which my condition would be reviewed. I signed the consent form and am now waiting to be called for the treatment. It must be now well over 2 years since I first felt the severe pains. I've taken painkillers since my first visit to the doctor, tried physiotherapy. I have reduced the pain in my hip as much as I can. It tends to come and go. Sometimes it's pure agony just to walk, other days quite bearable. I personally can do no more.